Hi, I'm Elaine Husney. I'm a rheumatologist here at the Cleveland Clinic. I am also the vice chair of the Department of Rheumatic and Immunologic Diseases, and I also direct the Arthritis and Musculoskeletal Center. What is psoriatic arthritis? So, psoriatic arthritis is an inflammatory skin and joint disease. So, that means it affects your joints and it can also affect your skin, known as skin psoriasis. What are the common symptoms of psoriatic arthritis? So this is a tricky question because there are many different symptoms of psoriatic arthritis, and everybody can present with and have different symptoms. So the most common symptoms that we have with psoriatic arthritis include swelling and pain in the joints. It can affect almost any joint in your body, but the most common symptoms that we see are the larger joints. So your shoulders, your wrists, your knees. It can, in some patients, affect your smaller joints, so in your toes, as well as your fingers. Some other very common symptoms are something called dactylitis, which is just a fancy word for almost like a sausage swelling of your finger or your toe. And then there's also something called enthesitis, which is where your tendons and ligaments meet the bone. There's a specific area that can get inflamed in psoriatic arthritis. So you can have pain in these areas that I just mentioned. What are the most common treatments for psoriatic arthritis? So treatment is really an interesting aspect of psoriatic arthritis because number one, it's actually a good time to have psoriatic arthritis because we have so many drugs that are available to treat patients that are diagnosed with this. Some of the more moderate to severe ones that we use are classified as the biologic DMARDs, and those are medicines that are a little bit more aggressive, but not necessarily dangerous to use at all. They just are able to treat more of the severe skin and joint symptoms. Common ones are TNF inhibitors. We have 5 different classes that are available. We also have cytokine blocking agents that we use, such as an IL-17 inhibitor and an IL-23 inhibitor. So it sounds like a lot of alphabet soup, but these are really great treatments targeting different proteins that are elevated in patients with psoriatic arthritis. What lifestyle changes might help psoriatic arthritis? The different lifestyle habits are going to be different for different people. So if you are overweight, we want you to be at your normal weight to help with your joints and other symptoms. But there's also lots of other things that we worry about. Very restorative, meaningful sleep is important. We all have stress in our life, but I think learning how to manage that stress is really important, especially when you have a chronic disease. I think diet and exercise. I think we have to really understand what level of fitness you're at, and we need to work with our patients to get them to incorporate a healthy diet and a really healthy way to exercise. What advice do you have for someone with psoriatic arthritis? I think the first item that I like when I diagnose a patient with psoriatic arthritis to make sure they understand the condition they have and understand how it's affecting them, because everyone I told you is a little bit different. And then second, I think what's important is to have regular checkups and visits. And then you want to anticipate if something does happen, your disease for some reason develops a flare or there's a change or you have a question about a medication or a side effect, that you have a way to communicate with the office. I think knowing those 3 things can be really helpful for someone living with psoriatic arthritis.